Hello everyone, we are from Group A and we will be presenting on acute rhinosinusitis. This is a typical case scenario of acute bacterial rhinosinusitis. Mr. P, a 55-year-old Indian policeman, presented with nasal congestion and fever for 5 days. He had a history of mucopurulent nasal discharge, facial pain especially in the cheek area under the eyes, ear fullness and fatigue. Further history revealed that he had occasional GERD with no previous history of allergic rhinitis or sinusitis. There was also no recent dental work done. He smokes occasionally, especially during social events, and there is also occasional use of alcohol. What is rhinosinusitis? It is an inflammation of the nasal cavity and paranasal sinuses. The etiology includes nasal infections, which could be due to bacterial or viral causes, swimming and diving where infected water enters sinuses through ostia, trauma in the cases of compound fractures or penetrating injuries of sinuses, dental infections which can lead to maxillary sinusitis. Predisposing factors of rhinosinusitis includes obstruction to sinus ventilation and drainage in the cases of nasal packing, deviated septum or hypertrophic turbinates. Environment can also be a factor such as cold weather or dusty area. Allergic rhinitis, gastroesophageal reflux and laryngopharyngeal reflux can also be predisposing factors of acute rhinosinusitis. The clinical presentation of acute rhinosinusitis includes an acute onset which is less than 12 weeks, nasal discharge or postnasal drip where the discharge can be discolored, nasal congestion, hyposmia or anosmia, redness and edema over the cheek, edema of the eyelids which is seen in the frontal, maxillary and ethmoidal sinusitis, history of preceding URTI where there will be an increase in symptoms 5 days post-infection or the symptoms will be persistent more than 10 days. Acute bacterial rhinosinusitis is a bacterial infestation over the rhinosinusitis. Hence, the patient may present with constitutional symptoms such as fever, general malaise or body ache. The patient may also present with ear fullness or pressure and mucopurulent discharge. Patients may present with facial pain or headache depending on which sinuses are affected. If the frontal sinus is affected, patient may present with frontal headache upon waking and subsides later in the evening. If there is ethmoidal sinusitis, there will be pain over the bridge of the nose, medial and deep into the eye. This can be aggravated by eyeball movement. If there is sphenoidal sinusitis, the pain will be localized in the vertex or mastoid region. In cases of maxillary sinusitis, there will be pain in the upper jaw, gums or teeth, and this will be aggravated by stooping forward, coughing or chewing.
For clinical examination, here's a video on nasal endoscopy. And as we can see here, there is mucosal edema, and we can also see the purulent discharge from osteomeatal complex. Investigation for acute rhinosinusitis, we can do middle meatal swab for culture and sensitivity, and we can also request for CT scan. This is to assess for impending complication, the subperiosteal abscess, and for surgery. As for the complication of acute bacterial rhinosinusitis, the orbital area, the complications are preseptal cellulitis, orbital cellulitis, subperiosteal abscess, and intraorbital abscess. For the osseous area, the complications is osteomyelitis, the subperiosteal frontal bone abscess, or Pott's puffy tumor. Intracranial area, the complications are epidural empyema, subdural empyema, brain abscess, meningitis, encephalitis, superior sagittal thrombosis, and cavernous sinus thrombosis.
Treatment for acute rhinosinusitis can be divided into treatment with complication or without complication. For without complication, the first one is intranasal steroid. Second is nasal douching. Third is decongestant, either oral or topical. And lastly, oral antibiotic. For treatment for allergic rhinosinusitis with complication, the first one is we have to admit patient into the ward. For patient in GP, the GP has to refer to the ENT specialist. Second is IV antibiotic. It is for the potential bacterial infection. Third is pharmacotherapy, either by nasal douching or decongestant. Fourth is the radiological imaging. This one is to rule out subperiosteal abscess. And lastly is the plan for the surgery. For example, endoscopic sinus surgery. Take home message. First, Seek treatment as early as possible. Monitor the symptoms and the duration for the common cold or flu. The patient has to comply to the medication and isolate yourself when you have worsened common cold symptoms. That's all from us. Thank you.